Hi, welcome to Midwestern University. We are first-year graduate students, and today we will be demonstrating Constraint Induced Language Therapy. This therapy consists of three principles: constraint, forced use, and mass practice. The participants are encouraged to use verbal communication rather than other modes of communication such as gestures and drawing. The participants are required to utilize verbal communication in order to request an item from another participant. This is done by requesting and describing the desired item on the card. Participants are required to participate in this treatment for 3 to 4 hours per day for 10 consecutive days. The protocol for this therapy consists as follows. The clinician explains rules of the game before starting, as well as models the types of requests and response participants must use. The clinician can cue phonemic or semantic information when necessary and must remind clients to communicate only with verbal production, no gestures or drawings. Cues can be faded over time as the clients begin to produce more accurate and independent language. Once the clients have achieved greater than 80% accuracy at the current level being presented, a new deck requiring a more complex response level can be introduced. First, you will designate participants to small groups of 3 to 4 people and give each individual a set of cards containing a picture. Place a barrier in front of each participant so that they are unable to see the other participant's cards or hands. They may be able to see each other's participants' eyes. Have one participant begin by selecting a card without showing it to the other participants. This participant must then address one of the other players and request the specific object on the card he or she has selected. If the co-player has the card, he or she will then give them the requested card. If they do not, they will respond that they did not obtain the desired card. All requesting must be done verbally, using spoken words or sentences. Again, no gestures are allowed. These steps will be repeated for each player in the small group.
Okay, Natalia and Danny, today we're going to start with our constraint-induced language therapy. In front of you, you have a Go Fish style game. Neither of you can see what pictures the other person has. For this game, I want you to request saying the name of the object in a full sentence. So for example, Natalia, you would say, "Danny, do you have the telephone?" And Danny would say, "Yes, I have the telephone," or "No, I don't have the telephone." Remember, for this game, we cannot use gestures or drawing. We have to say the word and in a full sentence. And if you have that object, you will hand the object over to the other person. Do you understand?
Yes. Okay. Natalia, do you have, I don't know what that is.
That is a fruit you eat.
Apple. Natalia, do you have the apple?
Yes, I have the apple. Danny,
Remember, no gesturing.
Danny, do you have the telephone?
Yes.
Remember, full sentences.
Yes, I do have the telephone.
Once the clients have achieved 80% accuracy, you can then move on to the second round. In this round, the task will increase in complexity, and the participants will need to identify the qualifier plus object. For example, do you have the red apple?
Okay, for this round, I want you to say the object plus the color of the object. So for example, Danny, you would say, "Natalia, do you have the yellow bus?" Remember, again, no gesturing or writing it out.
Natalia, do you have the truck?
What is the color of the truck?
Natalia, do you have the green truck?
Yes, I have the green truck. I don't know.
Do you know the color?
Brown.
Mm-hmm.
Danny, do you have the brown dog?
No, I do not have the brown dog.
Again, once the clients have achieved 80% accuracy, you may then move on to the third and final round. In this round, the task will increase in complexity again. The participants will need to identify the quantifier or amount of objects present plus the object. For example, do you have the 3 oranges?
Okay, for this round, we're going to increase the difficulty to kind of create more complex sentences and increase the length of your guys' sentences. So I want you to say how many of the object there is, so the number, and then the name of the object. So for example, you would say, Natalia, do you have 2 rings? Natalia would cry, yes, I do have 2 rings, or no, I don't have 2 rings. Remember our rules, no gesturing or drawing out.
Natalia, do you have books?
Danny, remember, no gestures, use your words.
Natalia, do you have 4 books?
Yes, I have 4 books. Danny, do you have
No gestures, remember.
Danny, do you have 3 oranges?
Yes, I have 3 oranges.
Constraint-induced language therapy can be used for individuals with mild to severe aphasia. This approach forces the person with aphasia to limit their communication to only verbal outputs instead of compensatory strategies, such as gestures, with the hopes to expand their verbal utterances over continued practice. Thanks for watching.